Hello and welcome. Today, we'll be discussing a serious and often progressive liver disease called sclerosing cholangitis. We'll explore what it is, what causes it, how it affects the body, and what can be done about it. The exact cause of sclerosing cholangitis remains largely unknown, making it a challenging disease to understand. However, it's believed to involve a complex interplay of genetic predisposition and environmental factors. A strong association exists with inflammatory bowel disease, particularly ulcerative colitis, with a significant percentage of patients with sclerosing cholangitis also having IBD. While autoimmune processes are suspected to play a role, specific autoantigens haven't been consistently identified. Bacterial infections within the biliary tract or other infectious agents have also been investigated as potential triggers, but clear evidence is lacking. It's crucial to understand that it's rarely directly inherited, meaning you won't necessarily get it if a parent has it, but there might be a genetic vulnerability. Sclerosing cholangitis, or PSC, attacks the bile ducts, which are essential for transporting bile from the liver to the gallbladder and small intestine. In PSC, these ducts become inflamed, leading to fibrosis and scarring. This scarring narrows and blocks the ducts, a process known as stricture formation. As a result, bile backs up into the liver, causing damage to liver cells and ultimately leading to cirrhosis, liver failure, and an increased risk of cholangiocarcinoma, a cancer of the bile ducts. The chronic inflammation and fibrosis also disrupt the liver's normal function, impacting its ability to filter blood, produce essential proteins, and metabolize drugs. Sclerosing cholangitis is considered a relatively rare disease. It affects both adults and children, but is more commonly diagnosed in men, with males being about twice as likely to be affected as females. The median age of diagnosis is around 40 years old. While prevalence rates vary geographically, it's estimated that sclerosing cholangitis affects about 1 to 16 people per 100,000 in the Western world. The association with inflammatory bowel disease is significant. Up to 80% of people with sclerosing cholangitis also have inflammatory bowel disease, although many might not experience typical IBD symptoms. The signs and symptoms of sclerosing cholangitis can be varied and subtle, especially in the early stages. Many individuals are diagnosed incidentally during routine blood tests that show elevated liver enzymes. Common symptoms include fatigue, itching pruritus due to bile salt accumulation, and jaundice, a yellowing of the skin and eyes caused by bilirubin buildup. As the disease progresses, patients may experience abdominal pain, fever, and night sweats, which can indicate a bacterial infection of the bile ducts, known as cholangitis. In advanced stages, signs of cirrhosis, such as ascites fluid buildup in the abdomen and variceal bleeding, can develop. Diagnosing sclerosing cholangitis typically involves a combination of blood tests, imaging studies, and sometimes a liver biopsy. Blood tests, including liver function tests, help assess the extent of liver damage and inflammation. Magnetic resonance cholangiopancreatography, or MRCP, is the primary imaging technique used to visualize the bile ducts and identify strictures and other abnormalities. Endoscopic retrograde cholangiopancreatography, or ERCP, can also be used, but is more invasive and carries a higher risk of complications. A liver biopsy may be performed to assess the severity of liver damage and rule out other liver diseases. While there aren't distinct subtypes of sclerosing cholangitis based on established criteria, it's sometimes categorized based on the size of the bile ducts affected. Large duct PSC involves inflammation and scarring primarily in the larger bile ducts outside the liver. Small duct PSC, on the other hand, affects only the small bile ducts within the liver, which can be more challenging to diagnose with standard imaging techniques. There is also something called overlap syndromes where a patient has PSC and another liver disease like autoimmune hepatitis. Currently, there is no cure for sclerosing cholangitis. Treatment focuses on managing symptoms, slowing disease progression, and preventing complications. Ursodeoxycholic acid, or UDCA, a bile acid, is often prescribed to improve bile flow and reduce liver inflammation, although its long-term benefits are still debated. Medications can also be used to relieve itching and manage other symptoms. Endoscopic procedures, such as balloon dilation and stent placement, can help open narrowed bile ducts and improve bile flow. In advanced stages, liver transplantation is the only definitive treatment option, offering a chance for long-term survival and improved quality of life. Regular surveillance for cholangiocarcinoma is also essential, as patients with sclerosing cholangitis have an increased risk of developing this cancer. Because the exact cause of sclerosing cholangitis is unknown, there's no definitive way to prevent it. However, maintaining a healthy lifestyle, including avoiding excessive alcohol consumption and managing underlying conditions like inflammatory bowel disease, may potentially reduce the risk of liver damage. Early diagnosis and treatment of cholangitis episodes can also help to minimize further damage to the bile ducts. The prognosis for sclerosing cholangitis varies significantly from person to person. Some individuals may experience slow disease progression, while others may develop complications such as cirrhosis, liver failure, or cholangiocarcinoma more rapidly. On average, the median survival time from diagnosis to liver transplantation or death is around 10 to 15 years. However, with advancements in medical and surgical management, including liver transplantation, survival rates are improving. Recent research focuses on identifying genetic markers, developing new therapies to target the underlying inflammation and fibrosis, and improving methods for early detection of cholangiocarcinoma. Clinical trials are ongoing to evaluate the effectiveness of novel drugs and treatment strategies. The hope is that these efforts will lead to better outcomes and a cure for this challenging disease in the future.